Welcome to LollieTasking. I invite you to join me and other amazing and inspiring women discussing our passion, work, discovering our purpose, interesting topics, and how we seem to have it all together. I hope we can motivate you and show you you can do it too with some planning, a little bit of balance, and a dash of determination. This is LollieTasking. Hello, LollieTaskers. I am your host, Dr. Lollie, and I am very excited to have on this monthly series, AfroPolitan Health on LollieTasking. On these episodes, as we all know, we dedicate the entirety of the show to a health topic in the spirit of renewing our body. My hope is by the end of the show, we would have educated you, empowered you, and motivated you to take action on your health. Today's show is dedicated to oral health and the prevention of oral diseases. Why is this important, you ask? Yes, come closer, let me let you know. Okay, so oral health is an important yet often neglected component of our overall health. It's linked to heart diseases, stroke, diabetes, and oral health helps us even see other diseases that we don't even know exist. Another thing that's great about oral health is it, besides just like the disease, it also affects our emotional well-being and the way we interact and engage with people and society. This is why I have brought my very own sister, and I'm not just saying sis as in, oh, sister, because no, I'm talking about my baby sister here, y'all. I got my baby sister here. I'm so excited. I brought my baby sister here, Dr. Busola, who is a general dentist in the DC, Maryland, Virginia area. And I have brought her here to talk about oral health and why this is important to the show. With that being said, I welcome you, Dr. Busola.
Hello, everybody.
Okay, so as we get started, all right, Dr. Busola, can you tell us a little bit about yourself?
All right. Hello, everyone. My name is Dr. Busola Olaseinde. I'm a general dentist in the DC, Maryland, Virginia area, like my sister has said. I'm Dr. Lollie's youngest sister. We're a pack of three, which is wonderful. And I see primarily adults, but I do see a few children. And, my main thing that I want people to take from this episode is that your oral health is very important. And it's not just to look pretty. It's linked to all sorts of diseases and every single part of our body. So I hope you guys enjoy and learn a lot today.
That's fantastic. So, one thing about LollieTasking is besides just educating people, we always like to know their journey. Like can you tell us a little bit about your journey on how you became a dentist and how you chose this as a profession?
Sure. Funny story. I actually wanted to be a pediatric surgeon since I was like maybe 10, 12. So
True story.
I had surgery when I was younger, and I loved my pediatric surgeon, and she was awesome, and I thought she was so cool. And I was like, yeah, that's what I want to do. And then I started undergrad at University of Georgia, Go Dogs. I just really, it's like I liked medicine. I liked aspects of science, but my sister, Dr. Lollie, was in medical school and was, starting residency. And I was like, this is not the life for me. I just I don't think I could do this,
I think you could do.
Yeah, it's not that I didn't think mentally I could do it. It's just like I just know the kind of lifestyle that I wanted to live. And I don't think, I didn't think at the time that going the MD route was for me personally. So we have a good family friend, Dr. Fowler in Atlanta, and he encouraged me to come to his office, and kind of the rest is history. And yeah. And I think, dentistry is a really, really good bridge between art and medicine, and I can still work with my hands, which is the most important thing for me, and talk to people all day. So it's awesome. I love it.
Oh, that is true story. Like we're gonna be the two doctors. We still are the two doctors in the family, but But I think a part of lollitasking is knowing what your purpose is and knowing
Right.
what you want for yourself.
For
And a
sure.
lot of people in the idea of wanting to fulfill a dream, right? They just continue on that path and they'll reevaluate. One thing I'm very proud of my sister was she took a step back, looked at the situation, and was like, maybe there's something better out there. And she got it, and she loves what she does. Um, Dr. Basola, what is oral health to you? Like
Or
when someone comes to you and say oral health, like what is it to you? What do you want people to think oral health is?
I want people to think of oral health as highly as they think of their own, like their systemic health, as a part of their systemic health, right? Oral health is not something that's separate. Your mouth, your head is attached to the rest of your body, right? So we as dentists, we call ourselves physicians of the head and neck because our teeth, our mouth, our tongue is attached to our head and our neck. And these things are attached to the rest of our body. And so I think when you think about oral health, think about that. It's not just my teeth. You got to
Mm,
think about everything else that's attached to your teeth, right, in your mouth. So,
right. Right. And I think like when I did the introduction for this episode, that's why I didn't say I have a dental health episode. I said oral health
absolutely.
because when you brush your teeth or when you go see a dentist, even though yes, like they're looking at your teeth, but it's not just about your teeth. It's about your gums, it's about your tongue. It's about the smell that your mouth ensues. So all those things are very important. One thing I've noticed though, like our people, and when I say our people, I'm thinking African Americans, I'm thinking Africans or people of African descent. We tend to put oral health at the lowest totem pole when it comes to our overall health. And we know there's been a lot of studies out there that has showed the connection between oral health and systemic health. Can you talk a little bit about one, the disparities among Africans and African Americans in the general population? And also some of the myths that you've heard from either Africans or African Americans and how we can kind of dispel some of those myths.
Sure. Definitely there's a big disparity amongst the people of African descent or the African diaspora, okay? For the most part, it comes from lack of education, right?
Mm,
And I think that comes with any health disparity for the most part.
right.
It starts with just lack of education and understanding um, what you're supposed to do and how you're supposed to do it. And for me, the most important thing that I try to do with my patients, the first time I meet them, is let's talk about why you haven't been to me in a while, or a dentist. Not doesn't have to be me in particular, but why haven't you been to a dentist in a while? What do you think? What is the biggest deterrent for you? Right? Is
Hmm.
it pain? Is it money? Are
Right.
there ways around curving that? And I think, especially in the African African American or African community, it's mainly access,
Mm,
education, and just fear, right? A lot of people come from, well, the majority of Africans and African American communities, we have this low socioeconomic status label,
hmm.
right? We have, especially in urban areas and some rural areas, we have food deserts, right? And in the school setting, it's just it's fact that most African Americans um, have they have lower access, right? And
Right.
so when it comes to our students, our kids in our schools, a lot of programs they try to do work with having school dentistry programs, mobile vans, and things like that. But it
Hmm.
shouldn't have to get to that level before we want to educate ourselves.
Right.
Does that make
Right.
sense? And
Right.
so I think the main thing for me is education. It starts with education
Right.
because if when people are armed with education, they go so much further. And when your
Hmm.
parents of the children are armed with education, it's like they don't have to wait for someone to tell them that
Hmm.
they should take their kid to the dentist before the age of 6 years old, which
Right.
is
Right.
6 years too late.
Exactly. I think it's interesting because as pediatricians, we are often taught to tell our families at 6 months old, they need to take their
Absolutely.
kids to the dentist. But one of the deterrents I have to say for a lot of families and even myself is like access, as far as like financial access to dentists, because I've always felt like dentistry should have been part of the overall insurance pool, right? Like
Absolutely.
a lot of people don't have dental insurance. They may have medical insurance, but a lot of them don't have dental insurance. What are the ways that some of our listeners, let's say, it doesn't even necessarily have to be like maybe they're poor or don't have the money, even like okay people can afford an average dentist sometimes, or is that a myth, right? Is that a myth that dentistry dental care is important, or and
Expensive.
or
um,
expensive? Yeah, it is
yeah.
important, but is it a myth that's expensive?
So I wouldn't say it's necessarily a myth, right? I would say that prevention is always cheaper. And I
Mm,
think that that's another thing I try to stress to my patients. If I
right,
saw you 6 months ago, you probably wouldn't have this big abscess, this big hole. Something might have happened in between that time. You ate something and broke a tooth or
right.
whatever. So, but what I call, unfortunately, dental insurance, I call a discount card, because it's not really insurance, right? All
Mm,
dental insurance does is give you a little bit of a discount on your treatment. And so especially in my office, one thing that my staff, my front desk staff always stresses is, if you know that you're going to have a particular procedure done, make sure that you can find the best insurance out there. Right.
mm,
So we're talking about people that can afford to have insurance, right?
right,
Make sure that you can don't be cheap and get the $5 dental plan, because that does
right.
nothing for you but give you your yearly cleaning, right?
Mm,
Make sure that you're equipped and like weaponize yourself with the right amount of tools, right?
right,
If
right.
you know that you have some sort of big procedure that needs to be done. But again, the most important thing is making sure you're coming in for the $20 cleanings,
Right.
right? Because
Mm-hmm.
$20 is much cheaper than $5,000.
Exactly.
And
Eh, Go ahead.
I think that for my patients, it's you don't have to go to the the dentist to the stars, and so a lot of people also feel like, oh, I need to go to this person because they saw this person, and that's not dentistry, right?
Hmm.
Those people, they do a good job and they want you to look good, but we're talking about like overall prevention, and
Right.
that's the most important thing.
I think that is very, very important you say that, because I feel like a lot of people in our society, or at least around us, I shouldn't say our society in general, right? A lot of people around us, they go to the dentist when now they have pain.
Pain.
Now they go to
Yep.
the dentist. And I think whenever, and this is for our listeners out there, whenever you set up your yearly overall well check, just go ahead and set up your yearly dental check to just have them look at it, have them do it. In addition to that, in the spirit of preventions, what are some of the things we can be doing at home to help us prevent getting that $5,000 job, you know?
Yeah. So, I mean, I think it's very cliche, but it's true. Brushing, flossing, rinsing, right? Just the things that just very basic level things. When you do notice something, go to the dentist then.
Right,
Don't wait it out until it doesn't hurt anymore, because just because it doesn't hurt anymore doesn't mean it's not there,
right,
right? So, for me, like, even when if you're gonna eat something, some people are snackers. They like candy, they like ice cream, they like bread, especially Nigerians. Us Nigerians, we like bread. My sister loves bread.
why are
So
you calling me out?
we like bread, we like rice, all these, carbs are things that stick on our teeth, and the bacteria loves carbs, right?
Right,
So
right,
rinsing out your mouth after you eat, just something simple, right? Because our saliva is a buffer for the acid in our mouth. And when we rinse out our mouth, it kind of brings us back to that baseline level that prevents the acid from eating and the
Mm.
bacteria from eroding our enamel and causing cavities and such. And so, one of the things that, just kind of sidetrack, one of the things that I think is good for my profession is that people are vain, right? People, it's true. Like, people want to look good. A lot of the
Right.
times, especially in this like urban area, in this DMV area, people, they want to look nice. They like their teeth. They want it to look pretty. So people a lot of times come, I want Invisalign,
Mm.
right? I want veneers.
Right.
I love that because that gives me an opportunity to say, that's awesome. I can definitely do that for you. But let's talk about
This
these
big old
cat.
hole.
Yeah, exactly. Let's talk about that because I'm going to get you where you want to be. But, that gives me a chance to educate people because
Right.
a lot of times people will have periodontal disease, which is a disease of the bone and gums, right? They have bone loss,
Mm.
and you might not ever have a cavity, but you have a whole bunch of bone loss in your teeth, or your gums and your bone are the foundation for the rest of your teeth, of your mouth.
Right.
So if you don't have healthy gums, you don't have healthy bone, it does not matter if you've never had a cavity. It does not matter if you have the prettiest smile,
Mm.
because by the time you're 50, you won't have any teeth, right?
Right. It'll fall
And
off.
so, right. And so, these are the conversations that I like having with people. I'll talk about veneers and crowns. I can do all of those beautiful things for you. But let's talk about your foundation, because a
Mm-hmm.
house built on sand will not stand, right?
It
So,
it sure would.
so
It sure would. So like talking about like cavities and stuff, and like we talked about earlier, like what a lot of people don't realize is that you know how they say your eyes is the window to your soul, your mouth is
mhm,
like a window to your whole systemic body.
right,
That being said, what are some of one, I want to hear both. What are some of the things that your dental health, like I think I mentioned some of it earlier, but what are some of the diseases that dental health can cause or make worse? That's number one. And number two, what are some of the diseases that you can have a clue of by your oral health? Like you see this, you're like, listen, I need to talk to your doctor. I think you may have this.
right,
You get both of them.
yeah,
One
yeah.
is what are the things that cause that, and the other one is the other way around.
For sure. So definitely in dentistry, one of the things that researchers and scientists have been trying to do is definitely find links between oral health and your systemic health, right? Because it is connected. There's no way you can separate the two. Um,
And when we say systemic health for the people that are not in medicine, we're talking about diabetes, hypertension, your blood, like anything outside your body besides your oral health.
right.
Okay.
So when we talk about diabetes, we talk about heart disease or cardiovascular disease. We talk about things like she was saying, systemic diseases. These things are linked to periodontal disease or any sort of oral health disease because it's kind of like they're comorbidities, meaning they're if you have one, you more than likely will have the other. Because if you're diabetic, you have a high A1C. You are probably you may more than likely are overweight. You know, which means you probably eat things that you probably shouldn't be eating. You don't exercise regularly. If you're a smoker, right? If you're a smoker, you have an increased risk for cardiovascular disease. You have an increased risk for diabetes, which means you probably have an increased risk for periodontal disease, right? And so
Hmm.
it's hard to, there's no hard and fast, like just because you have diabetes, you're definitely going to have periodontal disease.
Right.
It's hard to link them in that manner, but they're definitely comorbidities. They're definitely, um, but it's just because of the nature of why people get these diseases. And
Hmm.
so for me, if I have a patient that's diabetic, or I have a patient that is a smoker, or they have some form of cardiovascular disease, it's okay. What are we doing, right? So my job also, I'm not just a dentist. I'm a physician of the head and neck, right? So like, what are you doing at home to
Hmm.
reduce this diabetes? What are you
Right.
doing at home to stop smoking? I had a 15-minute conversation, almost 20-minute conversation with a gentleman who he's healthy. He said, but
Mhm.
I just got put on hypertension medication. My doctor says because I smoke. I was like, okay,
Okay.
probably, right? That's a link. There's a link between that. And let's talk about your smoking. How often do you smoke? Right? Because for me, it's, yeah, that's a link, but oral cancer is a very serious thing that affects a
Right.
lot of people, right? It kills a lot of people. Tongue cancer, throat cancer, and so we want to make sure we're just educating. Education, education, education is the most important thing.
Mhm.
And then I think I'm trying to remember the second half of your question because I feel like I kind of
So basically, like systemic health and how
right.
we see, like if you look in
Yeah, so
someone's
oral
mouth, can it kind of,
manifestation.
yeah.
Yeah, so definitely. There are a lot of diseases that manifest themselves first in the oral cavity before they you can see it elsewhere. One is leukemia, right? Especially with children under the age of 12. Most kids don't have the classic signs of periodontal disease, like the bone loss. They'll have gingivitis, which is like inflammation of the gums. They'll have a lot of plaque buildup. But true periodontal disease, if you see it in a child, you really should worry, right? You
Mm.
really should think about it and say, maybe I should send this child to their pediatrician to at least just get a workup, get,
Right.
blood drawn. And, luckily for us, um, people actually see their dentist more than they see their primary care physician, right?
Adults,
Adults,
yeah.
facts, adults see their dentist because they're like, oh, I got to get my 6 months cleaning, right?
Mhm.
They don't see us that often, but definitely more than they see their PCPs.
Right.
And so it's up to us to make sure that we are doing thorough exams, to
Mhm.
make sure that we are um, educating our patients when they come in with hypertension, when we take their blood pressure, because, for dentists, we're supposed to take blood pressure as well.
Oh, really? I didn't know
Yes,
that.
yes,
Mm.
we take blood
Okay.
pressure. We are supposed to take blood pressure before we do any sort of procedure. Just
I see.
yeah, just so that the patient and before in our new patient exam too, just so we have a baseline, right?
Right.
Because if we monitor them and that, because if they're not going to their PCP, at least they're getting that from us. And
Mm.
if a patient has increased blood pressure, one that we're a little leery of, sending, okay, maybe we should write a referral, right? There have been cases, friends who they've had patients come in with extremely high blood pressure. They send them to the ER and they're in emergency surgery that night.
Oh, wow.
You know what I
Okay.
mean? And
Yeah,
so,
yeah.
there are just a lot of things. So even besides leukemia, there's HIV/AIDS, right? It can manifest itself orally. Somebody might not know that they have HIV/AIDS, and we as physicians catch something, and
Mhm.
then we say, "Oh, you might want to just go get a workup, go get your blood
Right.
drawn."
Right. Right.
Catching these things early, and especially doing or a cancer screening is far beyond all those other things. We need to make sure that we're really really paying attention. And even you yourself as a patient, if things just don't feel right,
Mm.
if something just doesn't feel right, don't be afraid to ask. Don't be afraid to say, hey doc, I think I'm feeling something right here underneath my throat. It's kind of lumpy, it hurts sometimes. Say that. It
Right.
might be nothing, but it 90% of the time it's something.
Mm.
And so always catching it early is very very important. So there are a lot of things that manifest themselves. There's just a short list, but there are a lot of diseases that manifest themselves orally, and there are a lot of links between your oral health and your systemic health.
When it's all said and done, it all really all just boils down. This is so cliche, but I think a running theme in the Afropolitan Health on LollieTasking is essential. Prevention is better than
Prevention,
cure.
absolutely.
Like just definitely going in and getting your cues every 6 months, yeah, not every 6 years. Getting your
Right.
every 6 months checkup, getting your teeth looked at, not really because we want it to be nice and clean only, but because we want to actually have a real oral checkup. That's why you
Right.
go to the
Right.
dentist, not so you can have white teeth.
Right.
That being said, that segues me into my vain aspect of the show. So
I'm okay with that.
what about teeth whitening? We watch all this TV and all the celebrities and newscasts that have like teeth as white as porcelain, as snow.
Right.
one, is this healthy? Or what are the healthy ways we can have our teeth white? Like everybody wants white teeth, right? Like nobody wants like brown, ugly teeth. But what are some things we can do, or what are some healthy ways? Because I look at a lot of commercials and half the time, like, is this even healthy, right?
Yeah, for
Is it
sure.
even healthy to be whitening your teeth? That's number
For sure.
one. Number two, if it is, what are some healthy things we can be doing? Should we be going to our dentist and having it whitened, or should we just get a toothpaste with whitener on it?
Okay. So first, let's talk about the difference between whitening and bleaching, right?
Ah,
So when people hear teeth whitening, they think Crest white strips.
right.
They think that's what's going to make they think whitening toothpaste. They
Mm-hmm.
think whitening mouth rinses. So I know a lot of people who have all of those three things, right? They're like, I use a Crest, my teeth are still brown. Well, all those things just remove surface stains, right?
Mm-hmm.
They clean the teeth. They don't actually whiten the teeth, or they don't bleach the teeth, right? So the only way you can actually drastically change the color of your teeth is by bleaching the teeth, and you can only get that by a prescription from your dentist
Okay.
or an in-house treatment, right? There are places nowadays that you can go to the mall, and I always discourage people to do stuff like that, just because I feel like you don't know what products they have. They're
Mm-hmm.
not licensed, you know, and
Mm-hmm.
they're just in the kiosk in the middle of the mall, and let they have a light, you know, and they're shining on your
Let's
face,
talk
and
about the
there's just
sanitary aspect of
exactly,
it.
there's just no regulation when it comes to things like that. So please just be aware. If you're gonna get your teeth actually whitened and bleached, please go to your dentist, your local dentist, and talk to them specifically about your case. I think for most people, the question they always ask is like, am I going to get increased sensitivity? So you would initially, but it's not something that should last for a long time. um, and if you do get increased sensitivity, you can use toothpaste, anti-sensitivity toothpaste like Sensodyne, that works. I like Sensodyne, I use it. But when it comes to whitening, if you want to whiten your teeth, do it. There's no major issue that it causes. But before you whiten your teeth, make sure you don't have any cavities. Okay.
Mm-hmm.
Again, just going back to the actual disease. You have to make sure that you're healthy, because that's
Right.
the whitening portion is purely an aesthetic thing. So definitely whiten your teeth if you want. I've whitened my teeth. It's not a problem. It's
So
not a problem.
what are the ingredients in there that they use to whiten it? A
Sure.
lot of times.
It's carbamide peroxide, and the ones you take home. So we can give you at home bleaching. We'll give you a bleaching tray, and we'll give you the gel. Carbamide peroxide between 10 to 14% is the one that we use. We give to patients for at home care. If you're gonna do it in the office, it's at a much higher concentration. And so it's probably about 15 to 35% carbamide peroxide. So it's
Okay.
actually like if you the in office ones, you can actually see like that chemical reaction happening on the
Oh
surfaces of your
wow.
teeth. Yeah. So
So
it's pretty.
it like it scrapes the lining of your teeth. Is that what it does? Or
No, it actually opens up the tubules on your tooth, right? So your tooth has the enamel and your dentin. It opens up those tubules and actually causes this chemical reaction that turns your teeth whiter, right?
okay.
So
So
yeah,
it's
so
not like breaking down
no,
anything
no,
or
no.
okay. Okay.
So yeah,
That's
and that's what
interesting.
causes the sensitivity, because your tubules are open and they have to kind of
Hmm.
close back down. So yeah,
Oh,
the
so
air.
they eventually they close back
Mhm.
down. Okay,
Mhm.
that's good to know.
Yeah.
So what about in now segueing away from like venous, let's go to pediatric.
Yeah.
Okay. Not to put out your NISIS issue out there, but there's some kids that suck their thumb.
Yeah.
Okay. Can you talk a little bit about that and why that's not good, or when it's good, and what's the cutoff and things like that?
Yeah. So for sure, kids that suck their thumb, it's not. I mean, if you can avoid your child sucking their thumb, just avoid it. At all costs, because it's a very hard habit to break. I'm not a parent, but I do have nieces and nephews,
Mhm.
and I understand that, that's like a comfort thing for them.
Mhm.
So initially, when your child is younger, if they need something like a pacifier, use that beside, and not their thumb, right?
You
Kind of
could
encourage.
throw away a pacifier. You cannot
You
throw
cannot
away a
throw.
thumb.
Exactly. So you can try to. It's hard to really break that thumb sucking habit in a child. Definitely try to break it before the age of 4. So right before they're starting to develop um, their their adult teeth and their structure, right? Because thumb sucking can really lead to a lot of facial and skeletal not really deformity, but it can lead to some deformities. And so your
Malalignments.
malocclusion of your teeth, malocclusion of your skeletal muscles. I'm sorry, skeletal bone, and so structure. And so that's the main thing. It's just, and then when they're 12, 13, 14, and they have an open bite, which means that their teeth don't come together either in the front or the side, wherever they place or sometimes people do tongue thrusting. And so that's kind of when they just kind of kick their tongue out over and over again. And you see
Mm.
adults that do that, right? And you kind of notice that their teeth are a little off, is because that's the area that they've been pushing on their teeth for 20, 30 years. And
Right.
so yeah, and so that's an expensive habit as well, because when you have
Mhm.
to go to the orthodontist, they're going to charge you
Yeah.
to fix that. So
Not cheap
it's like
at all.
this is why it's education is just so important, because if people know these things, it saves them a lot of money in the long run, a lot of money in the long run. So definitely, yeah. Tongue thrusting, tongue sucking, lip biting, nail biting, all these non-functional habits can cause a lot of damage.
Okay. And staying with pediatrics, what about the use of fluoride? Can you talk a little bit about that, when it's necessary, how old, and things like that?
Yeah, so fluoride is always necessary, right? So when you bring a 6-month old and they have an erupted tooth, we're putting fluoride on there,
Mm.
because, well, it really just depends on the intake. With babies, most babies aren't they're not getting. Correct me if I'm wrong, but they're not getting tap water in their formula, right?
Usually not, yeah.
Right, right. So they're getting some sort of distilled water, some sort of yeah, distilled water in their formula. So their intake of fluoride is going to be pretty limited, unless there's fluoride in the formula, which I'm not really sure if there is or isn't, to be honest. But the most important thing is, make the exposure, increasing the exposure of fluoride, right? There are cases where you can have too much fluoride, which causes fluorosis. Um, but generally speaking, you know, most people, that's not gonna happen, right?
Mm.
If you live in a place where there's well water does not have fluoride in it,
Right.
right? If you are a family that only drinks bottled water does not have fluoride in it, right? And so, those are the times that you need to be, aware that maybe your child might need some fluoride supplements, right?
Right.
When you just are in an area, especially rural areas, that has a very limited exposure to fluoride.
To tap
But
water.
it's, yeah, tap water and city water. So if your family, you're in a relatively urban suburban area, you guys, cook with tap water, you drink tap water, even if it's filtered, that's fine. There's probably a low chance that your child would need any sort of supplement.
So are you saying, like, even like 6 months old, when you start brushing your baby's teeth, you should have a
Hmm.
little bit of fluoride in the toothpaste? Because you
For
see a lot
sure.
of baby toothpaste that don't have fluoride in it.
Yeah, I think because when you look at the parts per million, so the concentration of fluoride for a child, 3 to 6 months, you really don't need much more than maybe zero point 0.3 parts per million, right? Fluoridated water has zero point 0.7 parts per million of
Okay.
fluoride in it, right?
Okay.
So if you're drinking water, you, you're fine,
Mm.
if you and so and even just coming to the dentist, the fluoride that we administer in the chair has a lot of fluoride in it, right? So that those things, that's why when parents say, "Oh, I don't want my kids to have fluoride," it's we try to educate, right?
Right.
It's the granolas and anti-vaxxers, those are usually the people that are like, "Hey, I don't want fluoride," but they need to really understand the purpose of it. And
Mm-hmm.
those are the people that we see whose kids have a lot of staining, a lot of brownness, and they're like, why is my child's tooth breaking down? Well, you know, we need
You
to
don't have
educate.
fluoride,
Yeah.
yeah.
We need to
So
educate. And
speaking
it's not
of
even only it's eating too, right? It's just like what the
mm,
children are eating and the frequency in which you're eating as well. So
can you talk about grazers and what's the other one?
nib
Grazer and nibbler?
niblets, yeah.
Yeah.
So grazers are kids that kind of just um they they eat as just throughout the day, right? They're eating a little bit of this frequency. They're eating chips, they're eating candy, they're eating anything, even if it's cookies and stuff like that. A nibbler will eat and stop, and 20 minutes, I mean, an hour, 2 hours later, then eat. So when we talk about nibblers and grazers, we're talking about the frequency in which your child is actually consuming food. And the same thing actually goes for adults as well. It's not only children. And
Okay.
so the frequency in which, so if you're just constantly popping in a jelly bean every 5 minutes, your increase, it's true, your caries or cavity risk increases significantly because you don't give your mouth time for your saliva to buffer that acid, right? But
Mm.
if you eat, you drink water, 20 minutes later, I'm not, well, it needs to be more than
Maybe
20
two
minutes,
hours
but
later.
thank you. About 2 hours later, you eat that, you've given your mouth time to kind of return back to that baseline pH level that we need to not have a acid attack, I guess, on our teeth, right?
Right.
So that's really important for your child to kind of identify what they are, and if you can kind of help, even if you don't want your child to be unhappy, and parents are just like, oh, they just want it, I'm going to give it to them, but kind of
Mm-hmm.
supplement these things, right? If they're juice drinkers, maybe don't give them 100% juice, maybe add a little bit more water than juice, right?
Mm-hmm.
So they're
Like
still kind of,
dilute it.
yeah, dilute it, enough for them to still have, the fix that they need, but it's not a detriment to your child.
Right.
So
So essentially, what you're saying is, and we kind of talked about this in the cardiovascular health, it was like what you eat matters. Like what you're
absolutely.
putting in your mouth matters. Like you having a lot of sugar, yes, of course. Like bugs like sugar. You're going to have some kind of, you're predisposed. It's not 100% saying you will have it. You're predisposed to having it. So it's
Yeah.
actually better to like eat not throughout the day minimum chop, but eat when you're supposed to eat. Not only does that help your overall health, it also helps your oral health as well.
Yes.
So I think that's good to
Yeah.
keep in mind. We're talking about the granolas and the myths about fluoride. I want to bring it back again because I think we kind of skipped
Glance
over
over
that,
it.
glanced over that question. What are some of the myths that you've heard? It could be funny, it could be like, what?
Yeah,
For
for
some of
sure.
our people.
That root canals are bad for you, that it's going to cause you systemic pain, um that fluoride is bad for you, that, oh my gosh, I feel like it's always something. It's when it comes to definitely like the African population, because I do see a lot of Nigerians and Africans, and one of the practices I work in, a lot of it is like, for whatever reason, we grind. Africans grind their teeth like crazy.
Really?
Yeah, and it's
Hmm.
just something I personally noticed. There's no, like, this is my own scientific research. I just It's like we don't necessarily have a ton of cavities, especially the ones here in America. At least I don't know about Nigeria, but we don't necessarily have a lot of cavities. But we've worn down our enamel, right?
Really?
And
Huh.
yeah, and so one, definitely the stress
Mm.
of being in this place called America and trying to kind of keep up and pay your bills and all of that. Stress is definitely the number one factor of grinding and clinching. And so, that's one thing. And they'll say, well, there's nothing wrong with my teeth. I don't need that thing that's in my, I don't, you know, like I don't need that. I don't need that. I'm fine. There's nothing wrong with my teeth as far as getting like a night guard or a occlusal guard. And so that's always an interesting conversation to have, because they'll look at you like you're crazy. Like, why would I put something to cover my mouth? Um, but anyway, and just like, if I tell somebody that they have a cavity, they're like, well, it doesn't hurt, right?
Mm-hmm.
That's always the
Right.
first thing. It doesn't hurt. Just because it doesn't hurt doesn't mean there's not there. And just because
Right.
it doesn't hurt now doesn't mean it's not going to hurt in 2, 3 days or 5 or 6 months, right? And so that's the biggest thing with people. Well, it doesn't hurt, so I don't have to do anything with it.
Right.
No.
Yeah, you talked about like mouth guard, and it kind of helped made me think about what are some of the ways, like going back to thumb sucking, because this is very close to home for us. So,
Hmm.
what are some of the ways you can help prevent thumb sucking in little kids besides like putting anti-deterrents? That hasn't worked really, to be honest, in our case.
I think the biggest thing is just trying to eliminate it before it starts,
Okay, but
right?
what if it has already started?
I mean, no, there are some well, yeah, there's some dental appliances that essentially you can put in the child's mouth to stop them. But I mean, honestly, those little um those bitter things that you can put
Yeah,
on
the
the mouth.
deterrence, that
Yeah, I mean,
stuff don't work.
it just really depends on the child. Like, or there, you have to have maybe some sort of reward system, right? And
Right.
helping your kid say, yeah, hey, if I see you thumb sucking, you're not gonna get this and things like that. But it's really just kind of, you have to try to work with the child. You have to try to, and sometimes it just does not work.
Right.
Unfortunately, it's really hard. It's very, very hard.
In this
Um,
case, we just gotta go to the prayer, man.
Right.
'Cause, whew,
And honestly, I don't work with children every day, so it's hard for me to kind of give you, very hard, concrete specifics, because I can't tell you like this has worked for me and this has not worked for me, right? Or my the parents have given me this antidote, and
right.
so, but those are the kind of things that we tell people to do, and
Mhm.
then they're like, well, like in your case, they don't work, and
Mhm.
so you're like,
What to do?
sorry. Sorry.
What to do?
Sorry.
This again is why prevention is better than cure.
Yeah.
If we had prevented it when they were babies, we won't have to deal with that right now.
Yeah.
Okay. So, what are some questions besides me asking my dentist about how to stop thumb sucking in the kids? What are some questions you're supposed to be asking your dentist to kind of help guard or gauge your overall health?
Um, Definitely, like, well, do I have cavities? Basically, how do I brush, right? How do I get better? And I think that that's what people don't necessarily always ask. It's like the dentist gets up, they're like, "Oh, you don't have any cavities, you're good." But it's like, okay, well, is there something that I can be doing to get better? You know,
Mhm.
you
Mhm.
know, did I have a lot of buildup, like plaque
Right.
and calculus buildup? So the sticky stuff, the hard stuff that we feel in the back of our tongue after not getting a cleaning for a while,
Mhm.
how do I stop that? If I am grinding, how do I stop grinding? um some people are just okay with getting the, or of just saying getting a clean bill of health, right?
Right.
But you have to kind of arm yourself, weaponize yourself, um with increasing your literacy, your
Mhm.
oral health literacy. But generally speaking, I would say, just if you have a question about anything, just don't be afraid to ask. That's why, because sometimes people feel like dentists come in and out of the room and they don't
Mhm.
get them the opportunity. No, you need to hold your dentist accountable, right?
Right.
Stop them and ask them, hey, before you leave, I have X, Y, and Z questions,
Mhm.
right? Are you, sleep apnea is something that I think a lot of people have, right? And they don't see it as something that's manifested orally, right? So
Right.
let's say that you know that you have sleep apnea, or your partner tells you that you have sleep apnea. Talk to your dentist about ways that we can help you with that. Right? What are some oral appliances? Is there a way that I can, without having to use a CPAP? There are a lot of oral appliances that can be made for people with sleep apnea without having to, go to the CPAP range.
Yeah,
So
just like when your regular well checkup, like in
exactly,
other episodes I've said, like before you go to your doctor, like have the questions in your notes. Like it doesn't
exactly,
have to be the day you go you start writing a question. Just put it in your notes. Like, oh, the
yeah,
next time I see my dentist, I'm gonna ask this certain questions. And
yeah,
because if you don't ask, you don't know. And
you don't know,
this is part of what you're paying to see the dentist for. Like
yeah,
you're paying them to learn about their expertise. You're paying them to learn about your own overall health. And it's
right,
very important that you know your oral health, they know your teeth, and even asking questions like, okay, so yes, I have cavities. Are there any other potential problems you see that's coming up that could start
mhm,
preventing? So I
mhm,
think that is very important. We're gonna conclude with one or two other questions, but one question I always think about, at least from my pediatric practice when I was in general peds, was not only in peds, and this also goes to adults too. If you were to have a dental trauma on
mhm,
a permanent teeth,
mhm.
what are the things you can do that can help salvage that teeth, that can
Okay,
help put the teeth back? Is it even replaceable? You
right.
know?
So the question of is it replaceable just depends on the extent of the trauma. So if your
Yeah.
tooth completely fractures in half, it's not. There's nothing we can do about that, right? If the tooth avulses and comes out completely
Mhm.
in one piece, one thing you do not do is wrap it in tissue paper, right?
Oh, okay.
Never do that. Never wrap your tooth in tissue paper if it comes out. Find milk, put
Mm,
it in a cup, in a glass of milk, and make sure you see a dentist immediately, right? As
okay.
quickly as you can. But never wrap it in tissue paper. Don't put it in water.
Mm,
Okay. Um, so that would be what I would say. Dental trauma. A lot of people, unless it completely breaks, they don't ever see the dentist. If you hit your face on something, just go get it checked, right?
mhm.
Just go get a
Mhm.
checkup. There might not be anything. Don't just be like, oh, I'll be all right. It doesn't, because you might be all right this month, this year. In 2 years, you might need a root canal on that tooth,
Mm,
right?
mm.
Because that's just the nature of dental trauma.
Right.
The nerve can die, depending on the force of impact. So the most important thing, just making sure you follow up, prevention. These
Mhm.
are the things I will always harp on. And I love to talk and have a conversation with my patients. I do. I will sit there, and my hygienist is looking at me like, oh, can you hurry up, I gotta bring the next patient back.
Oh my gosh. My
So
medical assistants can probably relate because they're
yeah.
like, Doctor, hey, you got to, yeah.
My husband is like, I still have to break down my room, and I'm like, all right, but okay, well, have a good day.
That's why we have multiple rooms. Just another one.
Right. So,
Okay. All right. To wrap it, what can we do as families, friends? Because I want the whole idea of Afropolitan Health and LollieTasking is to not only educate our community about the health disparities that are going on, and also to just kind of like give out the information. So, what do you think people can do, or what are some community things you can do for your families, friends to just help understand one oral health and also spread the word?
I think that when it comes to, are you talking about me personally, or just like
Just
you, like
everybody,
anyone? Okay.
everybody. Yeah.
Yeah, I think one of the things is just don't feed into the myths, and just because you read it on Google doesn't mean it's true,
Oof,
right?
which-
So make sure that you're following up with a professional, a healthcare professional, about these quote unquote facts that we find on the internet. Okay, the internet has a lot of information. It has, really, really good things, but it also has a lot of negative things that that make people actually less healthy, right?
Mhm.
Because they're Googling these things and they come with their Google Sheets and they're ready to ask you all the Google questions, which is fine because I think that's also,
Room for education.
exactly a place of a room for education, like you said. So definitely just making sure that you're armed and equipped, asking the right questions. Don't be afraid. There's no such thing as a dumb question
Mhm.
ever. When it comes to just in the community, when we were talking about disparities, folks and people that are in the category of quote unquote low socioeconomic status, access to healthcare, doing your research as to, like, there are places that you can get free dental care. There are
Mhm.
places where you can get dental care on a sliding scale. There are places that, especially for children, most um, healthcare plans, a lot of children's needs are met at close
Mhm.
to 100%, even 80%, even if it's not 100%. Doing these things and educating early is so important.
Right.
Making sure, when you go to these health fairs, pick up an extra toothbrush, pick up an extra toothpaste, pick
Mhm.
up some floss, please pick up some floss. So, like, these things are ways that we, as not only African American people, can equip ourselves and arm ourselves. That's the most important thing. Educate yourself. Don't let it be up to your providers to let you know what you should be doing. Yes,
Right.
they're the experts. They're the source, but do like I ragged on Google a little bit. Do some googling. Maybe you'll find some stuff out, and like I said, it'll at least allow me to educate you.
Right.
If whatever you found is wrong, I can educate you, but don't let that be the primary source of
Right.
education, right? Um, and so definitely, I just want to let people know that, there are, yes, we talked about, the expense of dental care, but there are resources out there. Don't think that you have to go to the most expensive person and that's the only option. Sometimes it is depending on your community, but I think in America, especially as dentists, we're really trying to um, put ourselves in these rural areas and these areas of low socioeconomic statuses, that we can provide and help. And sometimes if you go to your dentist and you think that they might not, um, you cannot afford them, sometimes they do things out of the kindness of their heart, to
Mhm.
because they want people healthy. Dentists, just, we're not money grabbers, which is another myth. You know what I mean? Like, we want to see people healthy. We want to see people success. We want to see people happy, because dentistry is not only definitely about your health, but also about self-esteem for people, right?
Mhm.
And
Mhm.
so, my thing is to make sure people are happy and healthy and have really good oral health.
Okay. So I ask all my Afropolitan Health guests some of these questions. I think you've kind of mentioned one of the pearls of the specialty, which is like, prevention. So I'm going to move on to the next. What is one thing that you were shocked about to learn about your specialty when you became a dentist?
That dentistry is more than just drilling and filling. So what
Mm,
that means is dentistry is more than, because I think, but I think that's kind of like a consequence of our culture, is
right.
that before I knew Dr. Fowler, or before I knew these one or few older dentists, I didn't really know any Nigerian dentists. I didn't really
Mm,
know any African dentists, and even us, in this era of young black dentists or young African dentists, there still aren't that many of us. Most of our friends and counterparts that we went to undergrad with, I would say 90% of them went to medical school versus dental school, right?
right.
And so I think that just really understanding that there's just so much more to the profession. There's like so much information, and it goes beyond teeth too. There's
Hmm.
so it's awesome. It's just, yeah, it's
So
awesome.
anybody out there that is considering a medical profession but is not into that lifestyle of being in training for 100 years, dentistry is one place to look at.
Yeah, for
Um,
sure, for
so
sure.
how do you balance your life as a dentist? Because I know, you work.
Yeah.
Um, we physicians are always hating on y'all because I'm like, okay, yeah, you're 4 days a week. Okay, great. But how do you balance your life as a dentist and have time to do other things and kind of have time for yourself?
Okay, so the great thing about dentistry, well, I guess it depends on, what specialty you're in, but for the majority, maybe except oral surgery during the residency period. For the majority of dentists, we can pretty much pick and choose when we work, how long we work, um but it just would affect our salary, right? So
Mhm.
if you want to make a certain amount of money, you probably have to work way more than you want to as a general dentist, and as a specialist, maybe you don't have to work as much because you're making a little bit more money. But generally speaking, like for me right now, I'm in the grind mode of
Mhm.
my profession. So I work most weeks, every other week I work 6 days a week. So in saying that, I one of the things that I try to do is during my lunchtime, that's my time. That's me time.
Mhm.
Lunchtime, I'll talk to anybody. Lunchtime, I'll watch a show on Netflix. I'll take a nap.
You take a nap.
Yes, I'll take a nap during my lunchtime. Like things to like decompress, because as soon as
Right.
that door opens, I'm back to it. Right.
Uh-huh. Yeah.
Because dentistry is I think similar, in to the medical profession, in which you're going throughout the
Right.
day. Like
Right.
the grind is not stopping throughout the day. So as soon as I
Mhm.
get to work till the last patient leaves, I'm going. I'm moving. I'm physically exhausted at the end of the day.
Mhm.
So I mean, for me, definitely also working out. I wake up early in the morning to go to the gym because I know when I get back from work, it's not happening.
Right.
Right. Definitely the weekends. Even though I work some weekends, I like this morning I'm going to drink my coffee and watch, some a few shows. And then, I think it's just more so about giving yourself time to decompress. Like,
Right.
don't feel like you gotta just go.
Mhm. Mhm.
That's not it's just not gonna be
Be
healthy
nice
for
to
you.
yourself. Be
Be
nice to
nice to
yourself.
yourself. Take yourself on a spa day. Get your nails done. As a woman, right? Or
Mhm.
whatever floats your boat. Uh, get yourself together. And don't feel the pressure to like. And one thing that mentors always tell me, like, the money will come.
Mhm.
It will come. Treat yourself, like you said. Treat yourself nicely, right now. So for sure, that's kind of what I've been doing.
Good. And then what's your favorite quote?
My favorite scripture is Jeremiah 29:11. For I know the plans I have for you, thus says the Lord, plans to prosper you, and not harm you, plans to give you a hope and a future. So
Amen.
yeah, so
Amen. With
that's
that
that's
being
everywhere.
said, that it was fantastic having you not only because you're at thebum.com,
Thank you,
but
thank you.
also because you're my sister and we gotta show them how the old girls do it. So we are for people that don't know, we are a trio. She's the third of the trio. I'm the first of the trio. And we have another amazing sister that I'm sure will be coming on LollieTasking soon as well to share some of her wonderful knowledge. So today we learned about oral health. We learned that it is very important, like very, very important. Your mouth is the window into your whole body. So you have to take care of your mouth. You have to brush twice daily. You have to floss. You have to rinse. You have to, try to avoid foods that will make you have cavities. And most importantly, you have to have that prevention. Prevention is always better than cure. Thank you, Dr. Busola, on your insight on this topic. Please let our listeners know how they can get in touch with you if they wanted to, IG or not.
So I've just been on this like no social media thing for a while,
That's
but
good. Yeah.
I do have an Instagram. It's Busi DMD at Busi DMD. That's Busie DMD. And I'm not on really like Twitter or anything like that. I'm pretty lame when it comes to stuff like that. But definitely, if you're in the DMV area and you're looking for a dentist, you can find me.
Just send her a DM
Yeah,
at
you can
Boosie
send me a
DMD.
DM. But you can definitely find me at Smile HQ, in the
Okay.
Petworth area in Washington D.C. or in Bowie or downtown. So just kind of DM me, slide in my DMs, as the young kids would say, and I'll hope to see you soon.
Awesome. Awesome. With that being said, thank you so much for joining us, Dr. Busola. Is there anything else you wanted to say before we wrap this up?
Um, Actually, I just had a thought. I just kind of want to, especially for our adults out there who do have these systemic conditions and they are on a lot of medications, just make sure that you're keeping your providers aware of these medications because they can cause a lot of dry mouth. And like I was saying, saliva is very important to our oral health. And so, kind of keep us aware, abreast of what's going on. Don't be afraid to communicate with us. Give us that full medical history so we can help you better. Okay.
Amen. Amen. With that being said, thank you so much for joining us, Dr. Busola.
Thank you. Thank you.
All right. And thank you all for joining us in another inspiring episode of LollieTasking. We will have Dr. Basola's information in our show notes and also on our website at lollytasking.com. If you want to be empowered by daily health tips, please follow us at AfroPolitan Health on Instagram. And also don't forget to also follow us on our IG at LollieTasker or at Facebook at LollieTasking. Till next time, remember, you can do it too with some planning, a little bit of balance, and a dash of determination. This is LollieTasking.
Thanks for hanging out with us for another inspiring episode of LollieTasking. If you have any questions or topics you'd like for us to discuss, please contact me via lollytasking.com, or better yet, you can just send me a direct message on Instagram at LollieTasker. If you've liked what you've heard today, what are you waiting on? Just go ahead and click that subscribe button, rate and leave a great review on iTunes. And of course, do share with your friends. Till next time, this is LollieTasking.